Hey, Earl Stephenson Jr. here, your Atlanta board certified plastic surgeon, and welcome to Plastic Surgery TNA. And that's TNA, that means talk and advice. You are watching me here on YouTube, and I welcome my return viewers. Thank you so much for watching. Anybody new, thank you for joining. It really is a thrill to have you aboard with us. Hopefully, you'll return and we can help build this channel together. It's really important for first-time viewers and certainly my repeat viewers to come on, subscribe if you're new. If you're a repeat viewer, share. That really will help me grow the channel so I can do more things and get the information about plastic surgery out. My goal here is to educate you on plastic surgery. I would love for you to work with me, but it may not be possible for many reasons. So if you can't, you are armed and ready so that you can have the best outcome and the safest outcome. So on that note, today we are going to talk about BBL, and that's a really popular procedure. It's really escalated, and there may be a de-escalation, and we'll talk a little bit about that. But there's been a lot of chatter about the dangers of BBL surgery. And what I mean by BBL surgery, let me be clear. BBL surgery is an acronym for Brazilian butt lift surgery. It's, again, been really popular over a decade or more, kind of pushed initially by Hollywood, I would say, and everybody will point to Jennifer Lopez as kind of one of the, I guess, sparks in really appreciating the shape of a curvy woman, especially her backside. So I'm not saying Jennifer Lopez had a BBL, but just her shape influenced and galvanized a movement of women who said, hey, I don't mind being curvy like a Coca-Cola bottle. It's all good. And the guys and girls, if girls like girls, then they're like, hey, I love it. I love it. I love it. I want more of it. So BBL surgery helps shape the backside. And it basically boils down to a procedure that transfers fat from unwanted areas, much like your tummy, your upper or lower back, and sometimes your arms or thighs to your buttocks. And so it really helps a couple of areas. It helps those areas where you remove unwanted fat that may be a little bit stubborn and cannot be kind of reduced by diet and exercise, and then transfers it to a place where you really want a little more oomph. So it's really a nice concept to kind of utilize what you have and get the most out of it. The numbers for BBL have really been dramatically on the rise for at least a decade. I did a bit of research, obviously, before I did this podcast, as I always do, and I looked at the numbers and the number of BBL surgeries, and I looked from a time period of, let's say, 10 years, because we're approaching 2025, which I cannot believe. But over the last 10 years, from 2015 to present day, in 2015, there were about 4,700 BBL surgeries done that year. Fast forward 2023, which are the most up-to-date and current statistics, upwards of 38,000 BBL surgeries are done a year. So, there is a little bit of a movement for BBL reversal. I believe that's what it's called. You're reversing the BBL. And again, we'll talk a little bit more about that, but I'm probably going to do a whole nother podcast on that trend where people are saying, whoa, I that's too much. I want to be more natural, or I overdid it the first time, or I'm just sick of it for many reasons. But if you have a BBL that's done thoughtfully, I'll put it that way, then it's something that you can carry for forever. So the reversals are a little bit challenging to my mindset because I don't operate or have never operated, no pun intended, with the concept of stuffing the butt so big that you have this huge booty and these stick like legs. I always go on the theory of having the best proportions possible, whether that's your face, whether that's your breast, whether that's your waist, or whether that's your booty. So when plastic surgeons operate with that principle, I think they give you corrections and transformations that are timeless. When you get outside of that, then you have people who go, well, this doesn't even fit. So I need to get it reversed. I never really want to have or provide a surgery that a client wants to get it reversed just because they feel like it doesn't work for them anymore. There are rare occasions your breast augmentation on a lady young, and as she gets much, much older, she may not want to have that again. But that's rare. Having, someone have a BBL over a period of 5 or 6 years, and then 5 or 6 years later, they want it reversed. I think that's not how I practice. And so I don't even produce a result that would make client want to reverse it in a short period of time. So, having said that, again, we'll talk about BBL reversals in another podcast, but it is still a very popular procedure. Like I said, in 2015, there were 4,700 BBLs. In 2023, there were upwards to 38,000 BBLs done a year. So, why is it so dangerous? What's going on? Well, there have been a lot of deaths. And what I mean by a lot of deaths, they're not hundreds and thousands of deaths from this procedure. The death rate is about one, and I've looked it up, so I didn't commit this to memory. So let me see if I can find it. The death rate for BBL is pretty doggone low. I want to say it's 1 in 3,000. Let's see. Yeah. Okay. So the overall death rate for BBL in the U.S. is estimated to be about 1 in 3,000. So if you have, I said the high number was 38. Let's say we just kind of do the easy math. Let's say it's 30,000 procedures a year, 1 in every 3,000 patients. Unfortunately, there may be a death, so that's 10 patients out of 30,000. You say, oh, that's a small number, and it is statistically a small number, but for those families, those those patients, it's 100 out of 100. So it's devastating. So we always, as plastic surgeons, physicians, healers, we want to get the rate down as close to zero as possible. But again, if you're looking purely at the numbers, not a high death rate. In Florida, and this is where I believe, and the views I espouse on here are mine. I think Florida was the tipping point. It really highlighted what possibly could go wrong with the BBL because they had a slightly higher rate of unfortunate outcomes, deaths versus the national average. So everybody put a big giant microscope on Florida. And there are many reasons why Florida can contribute or has contributed to a slightly higher death rate. And I think the one thing that people really can focus on is high volume practices, where these practices are performing 6, 7 BBLs a day. And on average, or how can I phrase this? It stands to reason that when you're operating at such a frenzy, sometimes things get lost in translation, things fall through the cracks. But unfortunately, we can't have that in medicine when people's lives literally hang in the balance, whether it's for an emergency surgery or an elective surgery. So high volume clinics have had some miscues just because they're moving too fast. They're, as the kids say, they're doing too much. And so that really put a microscope on Florida. And so Florida was a little bit proactive and a lot reactive. And they put in some safety guards or bumper guards up for Florida plastic surgeons or cosmetic surgeons. And I challenge those a bit. Maybe they need to do that in Florida. Florida's a little bit more free flowing. But for someone who is well trained and thoughtful, the bumper guards may not be necessary, if I can say that. So let me give you an example. In Florida, I don't know if they've mandated or strongly recommended not only reviewing your training, making sure your staff is trained to support you as the surgeon, but instituting additional medical technology to help you place the fat where it needs to be placed. The problem with BBL surgery and why it can cause death is placement of the fat in an area that it shouldn't be placed, meaning the fat is or was placed in the muscle. And there was thinking at one time early on that placing fat in the muscle allow better take of the fat. And can kind of expand that muscle to a degree and give you a more shapely and a result that had more longevity. But what we found is, and through unfortunately mishaps and deaths, that placing fat into the gluteus muscle put the patient at risk for fat particles breaking off because they were placed into a big blood vessel. Muscles are big, they require lots of circulation, and they have big blood vessels that bring blood in and drain blood out. Blood placed into a vein, more likely an outflow, a lower pressure system, causes that piece of fat to get lodged into the lung system, which shuts down a section of the lung that doesn't allow it to get oxygen so that that oxygen can be pushed out to other places like the kidney, the heart, the brain, so on and so forth. And you end up with a lot of areas of this blockage of the lungs called a pulmonary, or excuse me, I call me a fat embolus. Then you have a problem because you have areas of the lung that aren't oxygenated and they can't supply oxygen to the other body parts. And that's a problem. It causes death. So, Florida has strongly recommended that surgeons know where they're placing the fat. They're not placing it in the muscle, they're placing it, you know, in between below the skin and the muscle. And that's affectionately called the subcutaneous tissue, which is just $1 million word. That's just below the skin in the layer of natural fat. So that's where you place it. But they've again mandated that you have an ultrasound guided placement of this fat. Now, I'm not one to poo poo safety. If anybody knows me, has followed me for some time, I'm all about safety. I have a question more than a recommendation or more than a chastisement of that recommendation. As a trained plastic and reconstructive surgeon, and I'm going to use the whole term, you, and I'm talking about generally plastic surgeons, should be able to tell when they are performing surgery at their optimum. They're not fatigued. This is not their sixth surgery of the day because they are well trained. They know anatomy. They've operated in this area multiple times for this type of procedure and others. Whether you are placing fat in the muscle, which has a different feel, or the subcutaneous tissue. Do you really need an ultrasound? Not saying it's not helpful, but do you really need it? And let me see if I can break it down so you can understand why I'm asking that question, because I don't use ultrasound. I've not had any deaths from BBL surgery, and I've done a lot of BBL surgery. I've kind of brought my numbers down because I enjoy other surgeries a little bit better, and I have a little bit more thoughtful approach than others with BBL surgery. And so my patient population or client population for that is a little bit smaller versus other procedures that I do. But nonetheless, I put fat into the subcutaneous layer. It's easy for me to tell where I am with my little cannula or metal straw so that I can place it in the right area. And I particularly don't use ultrasound, uh, but Florida strongly recommends this. Placement of the fat below the skin, let's say, it's just below the skin. It's for me, as I visualize and understand that, because I've operated in the area so many times. I know exactly where I am. I know the depth that it usually should I should usually place it, as opposed to, and I'm gonna use a totally different operation so I can drive on the point where ultrasound can be and is extremely important, because you got to know where you are. Is if you're going to intentionally place fluid medications in a deep, big blood vessel for whatever surgery procedure that you need to do medically, and you need to make sure that you're right in that particular blood vessel because it's deep and it's in three dimensions. You cannot blindly assure yourself you're where you are. Ultrasound is phenomenal, and necessary doesn't even begin to describe the word, is mandated. It's deep. You just can't blindly feel your way to make sure that you're where you are to inject something intentionally in a blood vessel. So if you're going to, let's use the example, you're going to get a heart catheterization. You might use an ultrasound to make sure that you're in the blood vessel. For fat grafting to the buttocks, all you need to do is put the fat below the skin and above the muscle. It's not really complicated as other medical procedures. So I question, in my mind, the utility of ultrasound and if it's necessary. And again, I'm not saying Florida is mandating this. I think they're making strong recommendations. Ultrasound also, in my opinion, probably slows down the procedure. It adds additional cost, and it maybe again in high volume practices. I'll stop picking on Florida, wherever they may be. If you're going to function in a high volume practice, then you may need this additional technology to assure yourself that you're where you need to go, because you're not there's no devil in the details. You're not being detailed and very strategic. So I don't operate it like that. Again, that's where I question ultrasound, but that's where we are. So the BBL procedure is just as we described. We take fat and we do traditional liposuction. Sometimes you can add energy to your liposuction. You can do Vaser, which kind of adds energy, maybe helps break up some scarred fat because maybe the person's had liposuction before. And so it can be a little tough. Sometimes people add energy to kind of help contract or shrink the collagen layer so that the skin kind of lays flatter and contracts a little bit tighter. But typically, just using tumescent liposuction, and tumescent means you just fill the area of liposuction to a point where it feels taut. And that fluid contains Novocaine or lidocaine, and it contains adrenaline, and it helps really with pain control and blood loss. So typically, the upper abdomen, the lower abdomen, the flanks or love handles, the upper back and lower back give you the most fat. They give you the most fat. You can liposuction someone's arms, you can liposuction someone's legs or thighs, but you're not going to get a really big haul of fat that will contribute, in my opinion, significantly to your BBL surgery. So the big haul of fat is from your upper and lower back, your love handles, and your tummy. And again, you can do the additional procedures, but you run up against taking too much if you want to treat the client as an outpatient. And what I mean by that is you can liposuction all the areas that I talked about: arms, legs, upper back, lower back, abdomen. And if you take out 5 liters, if you think of a Coke bottle, I believe a Coke bottle is 2 liters. So you take out 2.5 Coke bottles of fat and fluid, then it's not recommended that you send the patient home. So again, a danger of BBL surgery is maybe taking too much fluid, sending the patient home, because the body needs to kind of correct for that fluid, and it may be best to have that happen while you're monitoring the patient overnight in the facility. So taking too much fat, over 5 liters, and injecting in the wrong place can lead to BBL mishaps. So you want to make sure that you have protocols in place. Again, perform thoughtful operations for your clients and not push the envelope. So definitely you do those things. You remove the fat from the areas. And for me, excuse me, and for me, it's a nuance. I've evolved. Initially, I would operate, do perform my liposuction mainly on the back and tummy, take that and just stuff fat into the subcutaneous tissue of the buttocks to get the biggest buttocks I can, because that's what my patients wanted early on in my career. And at some point, I had a revelation where I'm like, this doesn't, I want to say, feel right. I got more strategic about the operation, what I was trying to accomplish. And what I came up with, and I think is where we are as plastic surgeons now, we're just not stuffing fat in the butt and taking fat out and just stuffing it. And not really concerned about the tummy, whether it has wrinkled skin afterwards or not. This is an subtraction and addition operation. What I'm really trying to do, and I'm speaking only for me now, is when I liposuction, I want to really shape the waist. I want to take it from the areas that we mentioned before, and I really want to shape it. And I want to make sure the candidate is a great candidate for liposuction, because just by shaping the waist, I've already made the buttocks look bigger or better, because I've created a smaller waist. And now I don't have to stuff fat, stuff fat, stuff fat to make it big. I can put, a good amount of fat in to contour, not to stuff. So that's where I am in the evolution. That's the word I was looking for, of treating clients who want a shapely silhouette. It's not just getting the fat I can get and stuff it. It's contouring the waist and making sure that that's where I need it to be, and then accentuating the buttocks with modest to moderate amounts of fat in the areas that need the best or the most contour. So that's where I am with my BBL surgery. And for the last 18 years, I've done that very successfully and with little to no problem and no deaths in my practice from BBL surgery. And I don't use ultrasound. And if I think I'm going to have a high volume liposuction greater than 5 liters, and I know that beforehand, then we're at the hospital and we're staying overnight, or we're at the surgery center and we're staying overnight. But most of my clients do not have over 5 liters that I remove. Sometimes it's closer to 3.5. And that client is a good candidate to have the procedure and go home the same day and be monitored as an outpatient. But whether you have high volume liposuction and fat grafting or moderate volume and fat grafting, still technique is important. Angulation of placement of the fat. I'm not placing the fat down toward the muscle. I'm angling it up. I'm putting it just below the skin. I'm shaping the areas just below the skin with the appropriate direction of my instruments so that I know the placement is safe and that we do not get fat into the big blood vessels of the muscle. Again, I'm not going over 5 liters so that we know that the body can accommodate and make the substitutions and corrections for the loss of fat and fluid so that you don't have blood pressure problems or kidney problems. So, those are some of the things that I feel can contribute to BBL surgery not being safe, and having a surgeon who understands that, who operates at a reasonable pace on a daily basis, is where you can make sure if you move toward having a BBL that things can be done as safely as they can. So, Brazilian butt lift surgery is a fantastic surgery. It really is and can be life changing. But I believe all things in moderation. Modest amount of fat grafting, good sculpting and contouring of the waist, and careful placement will lead to a successful outcome. So, is BBL surgery safe? Yes. In the wrong hands of the untrained, people who don't pay attention to detail, or flat out people who just don't care or don't know any better, it's dangerous. Just like if someone was doing your facelift or somebody was doing your tummy tuck, if they don't know what they're doing, they're operating close to the edge or on a margin and putting your life at risk, then any surgery is dangerous. So I think BBL surgery is really, in my personal opinion only, is no more dangerous than any of the other surgeries I perform. You, as the client, need to make sure that you know the following. One, that your plastic surgeon is board certified. And that means board certified by the American Board of Plastic Surgery. Number two, you need to talk to them about their experience. How many of these have you done? Really, if you've done a lot of them or a fair amount of them, what are some of the complications? What do you do when we have infection? What's the infection rate? Typically, it's 1 to 5%. What is the rate of seroma? What is a seroma? Seroma is a collection of fluid underneath the skin. How do you manage that? What are you doing if we need to go to the hospital? Should I stay in the hospital after surgery? Should I not? Why should I? Why shouldn't I? Ask those questions. Get on with the information. But as I said, you need to make sure that they're board certified. You want to make sure that they've got enough experience that you feel comfortable putting your life in their hands. You want to make sure that they've got good results of clients that have your body stature or the results that you desire. You want to make sure that they're thoughtful in their placement of fat. Their technique is good. You want to make sure that they're able to care for you after surgery. So these are some of the things that you can kind of have in your mind and jot down as a list of questions. There are many ways to ask it, and you'll know the right ways, but these are some of the things that you as the patient slash client should think about so that you can stay safe. So I know this was a quicker episode, but I thought I really wanted to touch on this. BBL surgery is safe in the right hands, in the hands of a competent board certified plastic surgery. If you have liked the content that I brought here today and you want to see more of it, I have a couple of podcasts that we've done over the last several weeks. I invite you to tune into those. You can follow me on TikTok. You can follow me here on YouTube. You can go to my website, www.esjaesthetics. Be happy to schedule a conversation with you if you're interested in BBL surgery or any other surgery that I perform. Happy to talk anytime. If you've enjoyed this, please share. I'm going to say subscribe to my channel. It really helps. I know I started off with that, but it really does. I really like to grow the channel. This is something new to me. I've been doing it I've been on video since the beginning of the year, and I really find it kind of invigorating to kind of get on here and talk and share, because I want you to have information or a perspective from someone with a lot of experience who's certified and does things by the book. So again, if you're interested and you want to help me grow so that I can help spread the word, please subscribe and please share. I would enjoy any comments that you have about this, any podcast, any questions you may have. Please leave them in the comments below. I often check back, and I'd be happy to answer any questions here. Or, as I said before, you can certainly jump on the website, fill out a contact form, or just give me a call at the office at 770-466-4700. So until next Saturday, I hope you guys remain safe wherever you are in the world. Peace.